Using spit instead of swabs, a homegrown company develops a saliva test for COVID-19, and we speak to the CEO.
Another day, another record jump in India, with the official count at 5.1 million coronavirus cases. Experts say the true number may be far higher.
And sold out in 10 minutes. Passengers snap up all the tickets for a 7-hour Qantas flight to nowhere. Hello, you're watching The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Dylan Ang. You can subscribe to the Straits Times channel so you never miss a single episode.
Well, let's begin with an update on the COVID-19 situation in Singapore. 18 new cases were confirmed today, the lowest daily figure in 6 months. They include one community case, a work pass holder.
There were also 2 imported cases who have been placed on stay-home notices upon arrival in Singapore. Today's figures take the total count to 57,532. The Health Ministry will share more details tonight. A homegrown company, Veredus Laboratories, launching 2 new COVID-19 diagnostic tools today that it claims will speed up the testing process and make testing less invasive and easier to access.
That's right. Well, according to the company, the saliva collection kit requires the user to spit into a container and can easily be self-administered. It's currently pending approval from the Health Sciences Authority.
The company also launched an extraction-free PCR COVID-19 test kit, which it claims shortens the testing workflow. It allows the user to perform the test directly from the swab, cutting the time needed for a complete test down to 90 minutes from around 130 minutes that traditional diagnostic kits require. This kit has obtained provisional authorization from HSA to be used by hospitals and medical clinics for COVID-19 diagnosis.
Well, let's find out more about these test kits with Dr. Rosemary Tan, CEO of Veredus Laboratories. So, Dr. Tan, let's first talk about the spit test kit. What are the benefits of using saliva samples, and what are the considerations that you had to take when deciding on this method?
Right, the saliva test is a test using saliva samples, and that, first of all, saliva is easily obtainable and is not invasive. Easy to collect, and then easy to be sent to the laboratory for testing. And then today, with the test kit that we put together with the extraction-free, or we call it a zero prep RNA extraction prior to the PCR, we remove a lot of processes that you require in the conventional real-time PCR test.
Now, of course, the big question, though, is what is the rate of accuracy, and do you see this spit test replacing or complementing the current PCR nasal swab tests?
The accuracy of the saliva test kit is similar to any PCR test kit, which is 99% accuracy. Whether it can be replaced by a swab test, it depends on the usage and also depends on the different authorities of different countries. So definitely it's easier to use, but more tests and more regulatory has to be done to ensure that we can use that safely and accurately.
Right. Well, moving on to your other product, the PCR-based IVD test. So how long will each test take compared to the current PCR tests?
We have a zero prep real-time PCR test kit that removes the extraction process from the regular conventional PCR test. So that itself will take away about 40 to 45 minutes of the test that is conventionally done. So that reduces the workload, that reduces the manpower and resources and all that, and also is able to increase testing capacity so that we can do more tests in a shorter time.
Now, going back to the saliva test kit, how do you envision the saliva test kit being used? Only at medical facilities like clinics or hospitals, or perhaps even at airports or MICE events?
Yes. So the saliva test kit comes in a collection tube. So actually, it's very simple. All you need is to spit in and then spit enough. And then after that is capped. And then we have a biohazard bag to be placed in for you to send it to the labs or the testing sites for the detection of using PCR. So it can be used in any location because it's basically you just need a tube to collect it. So you do not need to have a swabber, or you don't have to queue up to get a test done by the swabbing method. So whether or not it can be used in any locations, I think it's really up to our imagination. Anywhere that you need to have a test done accurately, reliably, easily, that could be a possible solution.
Right. Well, thank you so much for your time, Dr. Tan. All the best, of course, in this endeavor. We've been speaking to Dr. Rosemary Tan, CEO of Veredus Labs, who have just launched 2 COVID-19 testing products.
One that is non-invasive because it uses saliva samples, and the other PCR-based IVD test that shortens the testing workflow.
In other local news, Workers' Party MP Raisa Khan has been given a stern warning from the police for social media posts that promoted enmity between different groups and committed contempt by scandalizing the court. In a statement today, the police said they had completed their investigations in consultation with the Attorney General's chambers, following police reports lodged against Ms. Raisa on July 4th and 5th during the GE 2020 campaign. At a press conference on the 5th, Ms. Raisa said she regretted making insensitive and improper remarks and apologized to those who may have been hurt by them. She also said she did not mean to cause social division with her remarks, but had wanted to raise awareness about the concerns of minorities.
Meanwhile, a man who put up offensive Facebook posts under the moniker Abdul Malik Muhammad Ghazali has been given a stern warning from the police as well for harassment and posting comments on social media with a deliberate intent to wound religious or racial feelings. In a July 5th Facebook post, Abdul Malik said he was one of the first to leak out and make viral screenshots of Ms. Raisa's social media accounts.
Well, separately, the police said no further action will be taken regarding online posts made by netizen Xia Xue, whose real name is Wendy Cheng. The police declined to provide more details on what the online posts were about, but the investigation is believed to be linked to comments Ms. Cheng made about Ms. Raisa on July 5th and 6th this year.
Marina Bay Sands Singapore Casino has hired a law firm to conduct a new investigation into employee transfers of more than $1 billion. According to people familiar with the matter, the review will be done by law firm Davinder Singh Chambers and comes as Singapore Police begin a probe into third-party transfers at the casino. A patron had last year sued the firm after alleging that $9.1 million of his money was transferred to other gamblers without his knowledge, prompting investigations by both the US Department of Justice and local authorities. The lawsuit was later settled out of court in June, with the casino agreeing to reimburse the full amount.
And a man who allegedly assaulted an SBS Transit bus driver after boarding the bus without wearing a mask was charged in court today. Jafali Abdul Rahim faces 1 count of voluntarily causing hurt and 1 count of possessing an offensive weapon. SBS Transit said several of its drivers have been attacked recently for enforcing the requirement to wear a mask. In the incident on Tuesday, the commuter put on his mask only later. The driver was not seriously hurt and given 3 days of medical leave. While SBS Transit has condemned the violence against its drivers and will help them file for civil action if they wish.
India reported another record jump in daily coronavirus infections today, taking the total number of cases to 5.12 million. This as the pandemic extends its grip on the world's second most populous nation.
Well, the Health Ministry said that nearly 98,000 new cases were reported in the last 24 hours alone. And with 1 million cases recorded in just 12 days, India's rate of infection is currently the highest in the world. Deaths, which have been relatively low so far, are showing an uptick, and the country has recorded more than 1,000 deaths every day for the last 2 weeks.
Let's check in with India Bureau Chief Nirmala Ganapathy on India's COVID-19 situation. Now, hospitals in several badly affected areas like Gujarat and Uttar Pradesh are seeing demand for oxygen cylinders to treat ill patients triple, prompting urgent calls for help. How much stress is the public health system under?
So the public health system is definitely under a lot of stress. The thing with India is that, the infrastructure is weak in some part and it's quite strong in other parts. For instance, in the cities, the health infrastructure is quite modern. You have a good number of hospitals, you have a good number of doctors. But in the rural parts, sometimes people have to travel for kilometers to just get to a basic health facility. So what's happening in India is that, with the coronavirus now spreading to the rural parts and smaller towns and villages, there is this worry that if the cases increase, how will the health infrastructure cope? So what happened in India was that we had a very stringent lockdown, which started in March, and that kind of went on for 75 days. And that kind of gave authorities some space to kind of improve the infrastructure. So you had a lot of COVID facilities which came up. Testing was ramped up significantly. Oxygen production went up. But the problem now is that we are adding so many cases every day that all this is being tested now. See, the problem with India is there's no uniformity as far as the medical infrastructure is concerned. So that is proving to be a challenge. So what's happened is that the virus has just entered villages and the smaller towns. So the test is really ahead to see how much more strain the infrastructure can take at this point.
Right. Well, Nirmala, despite best efforts to restrict movements, they haven't been very successful in keeping the spread of the infections under control. How come?
India went into a lockdown where there were a couple of 100 cases.
Yep.
And people really religiously followed the lockdown. We weren't allowed to come out for anything except for buying essential goods. The economy was completely shut down. But the problem is that once the economy started opening up and people started traveling, the virus traveled with them to different parts of the country. So, there are sero surveys which are coming out now, which indicate that India actually had many more infections than the official data suggested. So that means the spread perhaps had already started even before the lockdown. So once, the lockdown, which also, of course, created a humanitarian crisis in the sense that migrants suddenly found themselves out of jobs and they couldn't go back to their homes. So there was a humanitarian crisis as well. So once, the economy opened up, they went home. There was cross-country movement of others. And that has kind of taken the virus to different parts of the country. So the lockdown, while it did help authorities better prepare themselves for the virus, I don't think had an impact in slowing down the growth of the virus as we are seeing now.
Now, what do you think are India's options going forward? Experts have criticized herd immunity as a viable solution, but is it India's main option now? What about a vaccine?
So I think the government strategy is to kind of just tell people, practice social distancing, wear your mask while going out, be hand hygiene, washing of hands repeatedly. And also, the fact is that India is a huge country and one strategy may not work. There's no one size fits all for the country. So for instance, in the smaller towns and villages, testing still, carries a stigma. People are scared of getting tested. So I think there needs to be like a communication campaign which, targets that perhaps from the government side. So I think it's all just people kind of practicing safe measures at this point until the vaccine comes, that is.
Well, thank you, Nirmala, for taking the time to speak with us. We've been speaking, of course, to Straits Times India Bureau Chief, Nirmala Ganapathy.
Also in the global headlines, a study released by Oxfam showed that rich nations representing just 13% of the global population have already bought up the lion's share of the promised COVID-19 vaccine stocks. The 5 leading candidates currently in late-stage trials will be able to supply 5.9 billion doses, enough to inoculate about 3 billion people. And some 51% of those have been snapped up by the US, Britain, the European Union, Australia, Japan, and Switzerland. The remaining doses have been bought by or promised to developing countries, including India, Bangladesh, China, Brazil, Indonesia, and Mexico.
Meanwhile, Chinese vaccine maker Sinovac Biotech plans to start a clinical trial of its experimental COVID-19 vaccine with children and adolescents later this month. This widening its test on a shot that's already in the final stage of study with adults. A total of 552 healthy participants aged between 3 and 17 will take 2 doses of Sinovac's CoronaVac or placebo in a combined Phase 1 and Phase 2 trial estimated to begin on September 28th in Hebei province. A Sinovac spokesman said the trial had been approved by Chinese regulators.
Tickets for a 7-hour Qantas flight to nowhere was sold out in 10 minutes flat. The special domestic flight will take off from Sydney on October 10th and include low-level flybys of the Great Barrier Reef and Byron Bay. Qantas said the scenic flight is for people who, quote, just want to spread their wings, no passport or quarantine required.
The next generation PlayStation 5 console will launch in November, set to go head-to-head with Microsoft's Xbox Series X and Series S. The standard PS5 will cost $499, while the digital edition, which comes without a Blu-ray disc drive, will cost $399. Both devices will launch first on November 12 in 7 countries, including the US, Japan and South Korea, and then on November 19th for the rest of the world, including Singapore. Sony has not announced local pricing information for Singapore yet, but it said pre-orders are starting today at select retailers without specifying which ones.
Also, Dylan, are you a gamer? Are you looking forward to the PlayStation 5?
I am actually. I've actually purchased. I'm a big fan of Sony, so I've actually purchased every single PlayStation that's been out since.
Really?
Yeah. So I have PlayStation 1, 2, 3, 4. So I'm looking forward to 5.
So it's about time you get it. So if your better half is watching, an idea for a Christmas present or even a belated birthday present, right? Okay, well, those are our top stories for today. For more news and videos, visit straitstimes.com and of course, subscribe to our YouTube channel by hitting the red button below.
Now, once again, I'm Dylan Ang with Olivia Quay. Join us tomorrow for more stories on The Big Story.